This is Dr. Manish Lashkare. I am a practicing physician at Batul and I am running my own Lashkare hospital at Batul. So today I am going to discuss dissolution technique in the Telmisartan formulation. As we all know that Telmisartan is a angiotensin receptor blocker and it is approved for treatment of hypertension. The mechanism of action of Telmisartan, it binds to the AT1 receptors with high affinity, causing inhibition of the action of angiotensin 2 on the vascular smooth muscle, which ultimately leads to a reduction in the arterial blood pressure. The solubility of Telmisartan in aqueous solution is strongly pH dependent, with maximum solubility observed at the high and the low pH. It is seen that different brands of Telmisartan may not produce equally desirable clinical effects at the same dose, and thus variability in therapeutic response is one of the problems with Telmisartan usage. Different factors responsible for the therapeutics response are highly variable. Pharmacokinetic properties like extensive first pass metabolism, low solubility, and high permeability as VCS class 2 drug, presence of food, use of excipients and diluents and lubricants. It has been observed that absolute bioavailability of Telmisartan is about 42% at 40 mg and 57% at 160 mg. The solubility in aqueous solution is strongly pH dependent, with maximum solubility observed at high and low pH, that is between pH 3 to 9. With any oral preparation, drug dissolution profile may be distinct due to differences in formulations and manufacturing process. As mentioned earlier, because of the variable therapeutic response seen with various brands of Telmisartan and the unique pharmacokinetic properties of Telmisartan, comparison of dissolution profiles and other parameters of generic Telmisartan brands with that of the innovator brand is required. Various methods have been used by the manufacturer to low bioavailability and improve dissolution of a poorly water-soluble drug is by formulation of a solid dispersion with hydrophilic polymer, polyvinyl, pyrrolidone, and other diverse carriers, and use of alkalizers. Sodium hydroxide is considered as a strong alkalizer as it provides maximum solubility of Telmisartan. Some of the generic and innovator brand contains sodium hydroxide and it creates a microenvironment pH around Telmisartan granules and thus enhances solubility of Telmisartan in the intestinal fluid. Unique technology is used by companies wherein micronized Telmisartan granules primarily mixed with suitable alkalizer, that is sodium hydroxide, and open label 2-arm randomized parallel study conducted to assess the viability of Telista, that is a quality brand of Telmisartan tablet formulations in 18 healthy male volunteers. Telmisartan peak plasma concentration is achieved within 30 minutes of oral administration and Tmax is 1 hour. The dissolution medium selected is pH 7.5. Phosphate buffer, which is a media specified for Telmisartan tablet as per FDA guidelines. USP require not less than 75% of the labeled amount dissolved within 30 minutes. The dissolution of more than 80% of the drug should be released within 1 hour is following the pharmacopoeial specifications. Compared with Mycardis, the innovator brand, Telista has shown 96.68% of drug release, which is a great phenomenon. So now we discuss the features of Telmisartan dissolution profile. Number 1, sodium hydroxide is a strong base which is used to dissolve as a drug is soluble in a strong base. Alkalizer used for improving dissolution profile in Telmisartan tablet is as per another brand of Telmisartan. The dissolution medium selected in is pH 7.5 phosphate buffer, which is a media specified for Telmisartan tablet as per FDA OGD guidelines. USP required not less than 75% of the labeled amount dissolved within 30 minutes. pH 7.5 is a recommended buffer pH in the United States Pharmacopoeia. Development of dissolution method was validated accordance with IC guidelines because providing the method of is experimentally sound, yielding precise, accurate, and repeatable results. So, learning from these all dissolution techniques and pharmacokinetic properties, it is clearly evident that using high quality brand like Telista gives us excellent results, and it is compared to innovator international brand also. It is as good as 96% dissolution profile as compared to innovator brand. So this is all I want to say about the dissolution profile of Telmisartan with the particular emphasis on quality brands like Telstar. Thank you.